Good afternoon, everyone. I'm Philip Osteen, the Dean of the University of Utah College of Social Work. My pronouns are he, him. It is my pleasure to welcome you to this webinar event, which is being held as part of the college's Pride Week. The mission of social work profession is rooted in a set of core values. These core values, embraced by social workers throughout the profession's history, are the foundation of social work's unique purpose and perspective. Service, social justice, dignity and worth of the person, the importance of human relationships, integrity, and competence. Today's event is one way the College of Social Work can uphold our values and ethics and provide the opportunity for others to think about the role of social work in working with LGBTQ2S plus individuals, families, and communities. I'm inspired by the students, faculty, and staff, and caring community members who have worked together to make an amazing variety of engaging and educational events possible this week. I'm especially grateful to Jen Nazawa, our Public Relations and Communications Manager, for her incredible efforts these past few weeks. We are grateful you've made time to join us live today or to those watching the recording at a later time. I also want to sincerely thank everyone who donated while registering. These donations will support the B.W. Bastian Foundation student scholarships that diversify community care. These scholarships benefit students seeking to work with LGBTQ clients in our community, and we're grateful for your generosity. Again, thank you. Before we get to today's presentation, on behalf of the College of Social Work, I want to acknowledge that this land, which is named for the Ute tribe, is the traditional ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the enduring relationships that exist between many indigenous peoples and their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. Today, we are proud to welcome Annie Charles and Ariel Malin, both from the University of Utah Transgender Health Program, who will present on social work's role within the LGBTQ2S plus community. Annie is a licensed clinical social worker. She has worked with people at many stages of life, starting with teens in a wilderness therapy program and then adults in residential substance use treatment. Most recently, she focused her work on serving the LGBTQ plus population at a local community health center. She now provides referral-based mental health services to established adult patients with transgender health program at the University of Utah. Throughout her career, she has been trained in various modalities, including eye movement desensitization and reprocessing, dialectal behavioral therapy, and numerous trauma-focused therapies. Ariel Malin is a health equity consultant, community activist, and educator. For over a decade, Ariel's passion and expertise has been working with the LGBTQ plus communities through advocacy, education, and research. She currently serves as Outreach Network and Development Specialist for the University of Utah Transgender Health Program and led the development of the Utah's only multidisciplinary gender health program. Ariel is a 2021 Utah Business Living Color Award honoree and has been featured on podcasts, panel events, and radio shows on the future of transgender health and LGBTQ plus advocacy. She earned a master's degree in healthcare administration from the University of Utah in 2018. Following their presentation, Annie and Ariel will have about 15 minutes to respond to audience questions. Please use the Q&A button at the bottom of your Zoom window to submit any questions that you might have. And with that, Annie and Ariel, the virtual stage is yours. Thank you.
Thanks so much, Dean. We're just going to get our presentation up and running, and we'll go ahead and get started. All right, let's just hop on to the next slide. So we've gotten some wonderful introductions already, but my name is Ariel Malin. I use she and they pronouns. I work with the Transgender Health Program in regards to their education and outreach initiatives. So we work very closely with system-wide initiatives to improve the healthcare experiences for trans and gender diverse people. And part of our mission is very centered on education. So being able to provide this content for mental health providers, healthcare providers, and also educate the general public on the health needs of trans people is a big priority for us. Annie, do you want to introduce yourself further?
Yeah, so I'm Annie Charles. I use the pronoun she, her. I'm a licensed clinical social worker here at U Health in the Transgender Health Program. Started in January, and we're still creating this aspect of the program, which is really exciting, so that we can provide kind of short-term services to folks when issues and crises come up, coordinate long-term mental health care and help with a lot of WPATH evaluations for second letters of surgery. Ariel is our public speaking master here, so I don't typically do these events. So if I go fast or don't explain something fully, feel free to put a message in the chat or in the Q&A. And yeah, I'll give it back over to Ariel.
Awesome. Thanks, Annie. Go ahead and go to the next slide. So a little bit about the Transgender Health Program before we get started. Like we mentioned in the introductions, we are the only multidisciplinary gender health program in the Mountain West. So we see patients from really all over the country, but predominantly in the surrounding Mountain West states. The care that we can provide here at the program is general primary care and medical services, things like fertility services, OBGYN care, laser hair removal, voice therapy. We also have a dedicated clinic that is provided to our transgender youth and gender exploring youth and their families. And then we also provide top of the line surgical care. So in regards to that, I like to mention that because I think oftentimes our mental health providers are not aware of services and places that they can refer to that provides gender affirming care, especially in states like Utah, where that care is a little bit few and far between. So making you aware of what services are available to clients that you're serving, I think is important. Go ahead and go to the next slide. So 3 big things we're going to cover today. We're going to go over some terminology and concepts. We're really going to start at the beginning, foundational level, just really getting people up to speed on LGBTQIA2S plus community language and terminology. Secondly, I'm going to turn the time over to Annie for these last 2, but understanding social workers' responsibility to the LGBTQ plus community, why it's important to be a competent gender affirming provider. And then lastly, we'll finish off with being able to identify some steps and tools for you all as social workers to affirm your LGBTQ plus clients. Next slide. And there's a few animations. Awesome. So I like to start these types of presentations with data. So there was a study released in 2021 that showed us that at least 20 million adults are identifying as LGBTQ+, and more than 2 million of those adults are identifying as transgender. We also know that millions more could identify with more expansive terms than just LGBTQ+, right? We also know that 7 to 9% of our youth are also identifying with these terms more and more. However, we know that these numbers that we're seeing here are underreported because there is still stigma in self-identifying as an LGBTQ person. We also know that there's differences in how we define this community and lack of consistent questions in federal health surveys and population-based surveys. We also know how we ask these questions of people can impact if they feel safe answering them. So there's a lot of factors that go into this data. And the reason why this data is so important is because it helps us understand health disparities, pervasiveness of anti-LGBT discrimination, and the economic impacts when we pass equal rights provisions. So it is a fact that we are seeing an increase in the number of people who are identifying as LGBTQ+. But contrary to popular belief, this is actually because in the last decade or so, we have seen an increase in equal rights protections for this community. Now, I know it doesn't feel that way because we've seen really hundreds and hundreds across the country anti-LGBTQ bills being passed. But really, if we look at throughout the decades as a trend, we have seen those equal rights increase. So as it has become culturally safer to be out about an LGBTQ identity, we are seeing that increase in these data trends. We also have seen an expansion of language around gender and sexuality, which we'll talk about, that has allowed many people to finally find words that accurately describe their experience. So it's important to recognize that LGBTQ plus people have existed since the beginning of time. You will see LGBTQ plus patients in your practice, regardless if you specialize in this area of care or not. So it is important to know this data. Next slide, and let's go all the way to the second one after that. Perfect. So when we talk about terminology and concepts, I want to emphasize here that everyone, regardless of identity, has a sexual orientation, a gender identity, a gender expression, and a sex assigned at birth, not just LGBTQ plus people. So the terminology that we use about gender and sexuality has evolved over time. How people describe their identity and how they identify can also change over time. So we tend to approach these concepts from a very fluid perspective. And it's important to recognize that these are all independent of each other. So someone's gender identity is not necessarily going to predict what their gender expression or their sexual orientation is going to be. So our goal is to help you understand how an individual's experience with these parts of their identity will impact how they navigate and perceive the world, thus informing the clinical skills that you use to support your clients. Next slide. So this first term is sex assigned at birth. This is sometimes referred to as biological or anatomical sex. It's the sex that an infant is assigned when they're born. And the reason that we say assigned is because current medical practice tells us that we need to assign a sex that is based off of the presence of certain external genitalia. So essentially, we're going to say the presence of a vulva or the presence of a penis. Without extensive testing, we can't determine an infant's sex because sex is more than just the genitals we have. It's our chromosome makeup, it's our hormone makeup. We have other sex characteristics that come into play here. So despite the fact that sex can be extremely variable, we still tend to categorize bodies into these two types of male and female. And folks who fall outside of those binary male-female assignments are defined as intersex. Intersex folks are born with differences in sex development. So this can be differences in chromosomes, hormones, or other sex characteristics. Now, a note here that not all folks who have differences in sex development identify as intersex or part of the LGBTQ plus community. But intersex is a word that we use to describe people with differences in sex development. There's some previous terminology that we don't refer to anymore. Intersex is the most up-to-date term. And then a caveat here, because from an administrative perspective, and you will come across this in your practices, sex assigned at birth is often confused with legal sex because it's really common practice to include sex on legal documents, your birth certificate, your driver's license, things like that. But this is a really inaccurate assumption that can be really harmful because one, people can go change their gender markers on their IDs. From a healthcare perspective, we need to know what organs a person has to determine their health needs. You as mental health providers may not be worrying about that as much. But being able to differentiate between the two, legal sex, which is on legal documentation, and sex assigned at birth, or maybe what was on someone's original birth certificate. Go ahead and go to the next slide. So thinking about gender, or more specifically, gender identity, which can be different from our sex assigned at birth, it's our internal sense of gender. It's who we feel like we are. So this is why it's impossible for us to know someone's gender identity without us asking them or having them disclose that information to us. And we shouldn't be assuming someone's gender based on things like their name, their appearance, their partners, how their voice sounds, things like that. Some terms that you might hear with your clients, cisgender, this refers to someone who identifies with the sex they were assigned at birth. So this could be someone who was assigned female at birth who identifies as a woman. So those two things for that person are aligned. Whereas someone who's transgender, this refers to someone who does not identify with their sex assigned at birth. So an example of this could be someone who is assigned female at birth who identifies as a man. So those two things are misaligned for that person. And this is one example of many combinations that can exist. We also are seeing that transgender is being used as more of an umbrella term to describe many gender diverse identities. So oftentimes you might hear people say, well, I'm trans and genderqueer. I'm trans and non-binary. And so sometimes that can go hand in hand, but some of the time it can mean something completely different. So I say that not to confuse you more, but also to just recognize that there is a lot of nuance in regards to identity and labels. These last three identity terms, gender fluid, genderqueer, non-binary, they're becoming increasingly more common as language has evolved to support the fact that gender is quite fluid. Um, when it comes to healthcare and experiences of discrimination, the folks that hold these identities tend to experience higher rates of discrimination because they're not necessarily ascribing to that binary of male or female, man or woman expression and identity. Next slide. So when it comes to gender, not all cultures experience gender and gender roles in the same way as American and Western society. So cultures across the world actually recognize multiple genders and intersex folks um, as really important, vital members of the community, which is not something we necessarily do here in Western society. So it's important to understand where our ideas of gender have originated, how these cultural ideas have been used throughout history, so we can see where we are today. So, gender and sex are actually not universal concepts across the world. In American and European history, the gender binary, again, the binary of man or woman, male or female, or just the binary meaning only two options, this has been used as a weapon to demonize gender diversity in Black and Indigenous people, and it's been used throughout history for justification for things like the assimilation of Indigenous peoples, colonization across the globe, criminalization, and even murder of non-white, gender non-conforming people. So these are very intentional efforts that have been made throughout history, and they still exist in today's present in really trying to control, police gender diversity in the general public. So we see this within laws that have passed recently in Utah, HB 257, the changing room or bathroom bill. We saw this in last year's legislative when we saw SB 16 pass, which banned certain types of care for transgender adolescents. So there's a lot of this going on with the same rhetoric around there's only these two genders. We need to put people in these boxes and creating laws that support that idea. So what I want to say here is that gender diversity, sexual diversity, and diversity in bodies is a really natural part of human existence. And being able to start deconstructing these really old narratives that have created so much harm historically and today, it gives us the opportunity to start seeing how complex humans really are. And that is your role as social workers to really get at the root of that. So this allows everyone to be able to better express themselves and live more affirming lives when we start deconstructing these narratives. Next slide. So another concept separate from gender identity or the gender that we feel like we are is also gender expression. This is that outward expression of our gender. So things that can be depicted through clothing, hairstyles, it could be body language. Again, someone's gender identity may not necessarily predict gender expression. Just because I identify as woman doesn't mean that my gender expression will look stereotypically feminine, right? There's so much variation. Exploring our gender expression is a very natural part of human development, but not everyone is provided that safe space to do so, especially if that exploration is looking different than someone's social gender that they were assigned at birth. Next slide. So gender affirmation, you're going to hear this a lot. We talk about gender affirming care as the type of care that we offer to trans and gender diverse people. It's a best practice approach. And it's something that is self-driven. So gender affirmation, gender can be affirmed in many ways. For some trans people, there may be a goal to medically transition or surgically transition so that they have alignment between their physical body and their internal sense of gender. But there's often times where people may not identify with a binary representation of gender. So that's why we don't assume whatever everybody's gender journey looks like, right? Transition is not this linear path of we start with hormones, we end with surgery. It's a case by case basis. It's completely unique. And not every transgender person will seek the same ways to affirm their gender. But let's talk about what that looks like. So, one of the ways that we can affirm gender is through social affirmation. This can be sometimes referred to as the coming out process. It could be communicating to friends and family about a new name or a new set of pronouns they want to try. It could be trying out new ways of dressing or how they present themselves to the world. For most people, finding a gender expression that fits them may be all that they end up wanting, and that gives them all the gender affirmation they need. Another option for people is body modifications. This is typically reversible ways of altering our bodies. For many trans folks, certain body parts can represent trauma from their past, and also with misalignment, right? With that internal sense of gender not matching what's on the outside, which is also referred to as dysphoria. So this could be the process of binding their chest to have a more masculine appearing chest, or tucking with underwear, or using prosthetics or packers. So there's a lot of options there. Another path are legal changes. Someone can go change their name or their gender marker on their legal documents. However, this is a fairly expensive process. There's a lot of hoops to jump through. So it's very common that when you're working with folks, they might have a name that they use that's different than what's on their legal documents. So from an intake paper perspective, always making sure that you have room for somebody's chosen name or the name that they use, and then what their legal name is, so you can match that with insurance. And then lastly, there are both medical and surgical options that are available to people to choose from. So there's a lot of options there as well. Last note on this. When it comes to gender affirmation, this is not unique to transgender people. Many cisgender people or people who identify with the sex they were assigned at birth may choose to affirm their gender in very similar ways. It's just not as normalized for transgender people. And so that's why we're seeing kind of this hiccup in understanding what gender affirming care really is, even though it's existed for a very long time. Next slide. So this is our last term that we're going to spend some time on, and then I'm going to pass it over to Annie. So sexual orientation. This can be thought of in actually 3 different dimensions. Identity, which is maybe like the label or the term that you use, behavior, and then desire. So sexual orientation is how a person identifies their physical, emotional, and romantic attachments to others. So some common terms you might hear include things like straight, gay, lesbian, bisexual, pansexual, asexual, queer, and there's so much more. So we're not going to spend time on educating about what all of these terms mean, because I think what's important to many people in the queer or the LGBTQ plus community is often that we want you to ask us. We don't want assumptions to be made about our identities based on things like our partners or our behaviors or how we look. So we want people to ask us, what are the terms that you use around your identity? Tell me more about that. And that also takes the burden off of you all as mental health providers, and any healthcare provider, honestly, so that you don't have to know what every term means, but being able to ask and not make that assumption so you can provide the space to better understand the folks that you're working with. So at this point, I am going to turn it over to Annie.
Thanks so much, Ariel. Appreciate it. So the next part we're going to talk about is how social work ethics and values really relate to and compel us to work effectively with and advocate for our LGBTQ clients. And so by going through school for social work, pursuing a career in this, it means that we have that ethical responsibility to our clients. So the dean had already listed those values, but the social work code of ethics is that set of standards and professional obligations that we're held to by choosing this. So those values are service, social justice, dignity and worth of the person, importance of human relationships, integrity and competence. So we should be carrying these into all the interactions we have. So not only working with clients, but when we see issues arise in our community, like that it happened here. So although we need to give ourselves time and space from work, these values should be something that we're internalizing and living out in our day-to-day lives. So if I turn these values off when I'm just moving through the world, I would be helping to create a world that is actively harming my clients and that I'm going to have to work against in my work with them. And working in the queer and LGBTQ community, there is so much overlap between the clients I work with and the folks I see in community spaces. And so I often run into clients or former clients, and if I'm acting unethically in those interactions, I would be doing harm to those folks that I'm working with. So going a little more in depth on each of these, that value of service. So when we're approaching our job as one of service, it means that we're putting the client's needs and desires first. So working with them to determine what their goals are and how they're going to get there. So for LGBTQ people, this might be related to their gender journey and how to affirm it. It could be related to like expressing and exploring their sexual orientation. And it might not be directly related to that part of their identity. But social issues can arise out of a person's identity due to society's and culture's response to it. So family rejection or discrimination and barriers to care. And so we really also have to be aware of our own biases when working in this area. And if we notice any sort of like friction or tension arise with something that a client is expressing or saying for themselves, that we're addressing that within our own supervision and therapy so that we're not letting the work that we might have to do impact the work that the client is actively doing with us. That next value of social justice is highly applicable when working to LGBTQ clients. And Ariel spoke on some of that, but there are so many areas, especially right now for trans folks, in which there's more and more discrimination. So in our state, trans youth don't have access to medical care in that way. They have to go out of state if they want to access certain forms of medical care. They don't have access now to bathrooms in schools that align with their gender and have to create plans with administration. And they're not allowed to play in sports with their peers. And then trans and gender diverse adults are being restricted in what changing rooms that they're able to go into. And in our prison system here in the state, it was just sued last month for discriminating against trans people who are incarcerated. So they were denying medical care for nearly 2 years to someone, and the Justice Department right now is suing us. So it's crucial that we as social workers know about these attacks that are happening and then advocate for LGBTQ people and their rights, as well as then healing the harm that comes from these issues that arise. And then dignity and worth of the person. So each person we work with is going to have their own goals and experiences. And this is what makes each person unique and gives them their strengths. And so we need to not only be mindful of this, but to celebrate our clients' differences and uniqueness. And this is absolutely the case for our LGBTQ and gender diverse clients. There is such a value in having to gain an understanding of oneself, choosing to embrace this in face of an aggressively cis heteronormative culture. So our LGBTQ clients are bringing this experience into the work that we're doing with them and leaning on those strengths that they have. So we need to be aware of this and actively making sure that we're not adding to the work and are really enhancing it. And then the importance of human relationships. So finding and connecting to community is so important for the LGBTQ community. So often, especially here in Utah, with the prominence of the LDS church and faith, the communities that they come from can reject them. So nationally, LGBTQ youth make up about 20 to 40% of homeless youth, but in this state, it's actually 50 to 60%. So we find that there is a lot of rejection that happens to queer youth in this state, and it causes a lot of repercussions in their physical and mental health. So it's important to not only link our clients to resources that can help support them, but to communities that they can connect with. So they need to see that they have value. And that just doesn't happen always in the therapy work. It happens when they're actively connecting in community, connecting with people that affirm them and that share their own experience, when they're able to see other ways of being and being accepted. And there are so many grassroots organizations or spaces for queer people in Salt Lake that change lives. And so I'll go into some of those later too. And then integrity too. So in order for us to effectively do our work, we need to be acting ethically in all areas of our life. It needs to extend outside of our offices and our practices. So if we have an LGBTQ client that we affirm in session, but then advocate for laws or policies, beliefs, or events that harm them in their day-to-day lives, we're not able to effectively do our job or live up to that professional code of ethics that we've committed to. So our clients may and likely will see us in the community, like I said before, and if we're expressing values that are different from that which our code outlines, we're not abiding by those commitments that we've made and frankly don't fit in this profession. So in order to be embodying these values, we have to be acting in that integritous way and be affirming our queer clients and their identities, not only within our work, but in our day-to-day life as well. And then competence. So to be competent, it doesn't mean that you have to know everything about every community. It's just not realistic. And it's not fair to yourself to think that you're going to have all the knowledge going into your work. We're going to be approached by communities or people that we're just unfamiliar with. But what it does mean is that if we're faced with something we didn't know about, that we are not putting the onus of the responsibility on the client to educate us, but we're willing to educate ourselves on these things. So that happens a lot of the time with LGBTQ people, especially trans clients, of having to educate their therapists, their doctors, their professors, that they come into contact with. And we should be educating ourselves on these topics, whether it's seeking out training, speaking with our supervisors, finding advocates and educators online or in social media. So it really doesn't have to be always a formal education. A lot of the education I've got has been training specific that I've sought out, or just by being involved in the community and going into different spaces that center queer, trans, and LGBTQ people. And looking at what media and kind of content you're taking in your day-to-day. So then going into best practices, I'm going to take a look at the Q&A. So I see someone ask about the social and cultural support. So those, as I briefly said before, are very important for a person's health, right? They have to know that they're valued, and that they have space to come into. And so really connecting to community that is uplifting and positive, I find is really important. So some of those best practices. So in working with our LGBTQ community, it doesn't only happen in our therapy setting or a social service setting, it's going to happen at all levels of the work we do. So not only in that direct work, but in like group and organizational, right, that meso level work, and then in a community and a large scale work. So working in that macro setting, and it just helps me kind of conceptualize how I can break that down. So I might not have broken it down to the T, because I haven't had to think in that framework for a long time. But it just helps to know that not only are we doing work in this direct care setting, but we should be connected to and doing that work within our organizations, within our communities, so that we're uplifting and affirming LGBTQ people in all areas that we're moving through. So when the first step, I think, in working with people within the queer community is to approach people with genuine curiosity and not make assumptions. So this can be based on appearance that we might making assumptions or names, but also like referral information and intake paperwork we might have. So clients may disclose different information when working with you, like throughout their time. So they might not know if you're an affirming provider, so they don't disclose everything. And so really allowing them to express that throughout their time with you. So asking them about themselves, being open to this changing over time, because as Ariel said, gender identity and sexual orientation are very fluid and can change over time. And so we need to really give that freedom to our clients when we're working with them, and empower them to be willing to explore those things. So approaching with curiosity is really important so that we can better understand the folks that we're working with, and ultimately connect with them better. And if we're not understanding them, if we're not being empathetic, right, we're not able to do effective work, because that trust just won't be built. And if that trust isn't built, they're not going to be able to work towards whatever goals they might have for themselves. And then another is just deepening that idea of approaching with curiosity. Is we should be asking what clients what their chosen name might be. It might not be on their paperwork because, right, legal names might be different than the name they choose to go by. So asking, what name would you like us to call you? What would you like to go by? And then also letting them know we may need to use their legal name if we're billing for insurance or accessing social services. So letting them know, right, asking what's your legal name, explaining how and why we might need that, but then letting them know that we would refer to them by their chosen name so they can be in a space that is affirming, but still access whatever services and care they might need to. And then pronouns, right? In the same thread of referring to people by their chosen name, making sure we're referring to people by the pronouns that they use. So these, right, are she, he, they, but they can be more expansive than that. There's a lot of neo-pronouns, so just asking what those are and then adhering to that. And everybody, right, uses pronouns regardless of what some folks may say. It would be really difficult if we always had to refer to ourselves in the third person or call everyone by their full name. And so everybody uses pronouns. It just depends on which ones fit for them. So when meeting clients, it can be helpful to ask, right, what pronouns do you use, and introducing ourselves with ours too, so that they know that this is an open and affirming space. So sharing your pronouns is an important step to be able to create that welcoming environment and foster trust. And then if we do make a mistake of misgendering someone or using their legal name instead of their chosen name, that is a mistake that we just have to correct quickly and with care. These mistakes may happen, but when they do, we want to make sure we're not centering our own mistake, error, or guilt, and apologize when we recognize it, or say thank you if someone corrects it. So we apologize or say thank you, use the correct pronoun, and then move on so that we're acknowledging the mistake. It shows that we care about how we're communicating with them. We can be accountable, which is a really good foundation of whatever work you might be doing. And we're not making the other person feel uncomfortable or putting work on them by profusely apologizing or centering our own selves in that. So if you don't know someone's pronoun, you can always just use they or them to be neutral, and then ask them what that might be if that does come up. And just knowing, folks, if we're being genuine and we're not making these mistakes often, they can be receptive, and by correcting it, moving on, apologizing, it really highlights the respect that we want to have for them. And then in the same vein of using that they, them for folks who we might not know what their gender identity is or what pronouns that they use, just using gender neutral language in the areas of our work, because the language that we use affects how safe or included and welcomed people feel when accessing our care. So gender inclusive language in our day-to-day lives can just degender and avoid unnecessarily potentially triggering situations for folks. So for example, a lot of terms that we use might assume a person's life or their relationship dynamics. So instead of using mom or dad, using parent, because someone might have two moms, or some people aren't married but have partners. Some people live with roommates or multiple partners, caretakers. Some people have chosen family that they lean on instead of their biological family. So just being, again, curious and asking what what's important to folks, what terms they use, so that we can neutralize it and provide a space that's welcoming and ultimately fits their lives, because we'll be able to do a lot better work if we know what their life looks like in the day-to-day. And then in working with our LGBTQ and queer clients, we need to be aware that this is not the only part of their identity. So their culture or religion, family of origin, ability status, all these other aspects are going to impact their life and will determine how their identity might interact as a queer person. So being in Utah, right, a lot of folks grew up LDS or are currently active in the church. And so that's going to look different potentially from someone who didn't grow up in that faith. Oh, excuse me. We also have a really large Polynesian population here. And so they have different gender identities that you may not know about. And so again, bringing in that curiosity and understanding that the intricacies of someone's identity will impact the way in which they move through the world. And we don't have to come in, again, knowing that everything about different cultures, but we need to be able to listen and then do research when things do come up that we're unfamiliar with. And so because of people's different backgrounds, they might have different life experiences that impact them. So depending on someone's family of origin, there may not be acceptance of their gender identity or sexual orientation. And because of this family rejection, it's common for LGBTQ people to have chosen family and friends. And it is important when working with clients to know who is important in their life and who their active supports are. Outing to the top right is an involuntary or unwanted disclosure of a person's sexual orientation or gender identity. So it might happen to clients while you're working with them, or it may have happened in the past and still affect them today. And so knowing how to have conversations around that, as well as around issues of misgendering, like we talked about before, or dead naming, where you use someone's a former name instead of the chosen name. And so knowing how to navigate these conversations, knowing how to help clients cope when they come up, knowing how to help them advocate for themselves if that's something that they want to do, being an advocate for them if you're in a space and you notice this happening, because that will show, right, that you're taking that active role and caring for them. And these can be incredibly damaging to people's mental health. And so knowing how to address them when they do come up. And so moving beyond the micro and into that meso, doing research and knowing what resources are in our community that clients can access and work with. There are lots of local groups and spaces that clients can connect to and that can drastically change their well-being. So I put some of them here. So there's under the umbrella is a queer bookstore. They have a lot of different events, book clubs that will come, as well as the Legendarium. They have like a trans social group that meets every Friday, and then they have another group that meets every other week to just connect with people in their community. There's Burning Sissy Valley that's specifically for BIPOC queer people again, and then Unidadix is specifically for the Latinx queer community. So knowing that these intersections are going to come across and there are different groups here in Salt Lake that you can connect folks to. And then being involved, not only connecting our clients to these community resources, but involving ourselves in it. And again, it might be hard to do with how much people are working or if they're feeling burned out or tired. But it doesn't just have to be work. It can be really enjoyable and then liberating to be connecting with community in meaningful and really fun ways. So there are a lot of different ways it can look. There's Stonewall Sports. There's Pride Ride that just happened last weekend, where it's just raising money for local nonprofits and centering like queer people in the outdoors. There's the Utah Gay Rodeo that's happening this summer. That's a super fun event. There's a Queer Spectra, which is an arts festival that's coming up. And so these are really just the tip of the iceberg. And if folks do want more resources, you can just send a message, and after I can make sure to send out the list that we have here. It's kind of ever growing because there's constantly things coming up. I just learned that there's a like gay football league here. That is really cool. So there are a lot of fun ways that you can connect with the community, and then also be showing your support, right? If you don't have the time, donating money. If you don't have money, finding ways to just be involved and spread the word around it. And a big caveat to that is if you are not queer, to look into if these events or groups are specific to those people or if they're open to allies. So if they are open, just making sure you're not centering yourself when you're in those spaces, but you're going to be a support. And then not only should we be connecting our clients to these spaces, but we should be advocating for every space to become affirming and uplifting for our queer clients. We should be critical and then aware of shortcomings that might come up within our schools, our organizations, so that when we see something that's affecting LGBTQ people, that we're advocating for change. So with a speaker coming in, having a counter event that's celebrating queer people, encouraging alternative speakers in the space, decking out your school in flags is a really good way to be able to advocate for some of that change. And it can also extend right to that gender inclusive language. So making sure whatever paperwork we're using is doing that. So beyond that, going into the value of competence, we should be intentionally seeking out training and being a part of it, whether it's formal or informal, to LGBTQ care. So that can be attending conferences. The Mountain West Transforming Care Conference is one that the university does, and Ariel is a big part of. It can be becoming a member and going to trainings for the LGBTQ Affirmative Therapist Guild. The AIDS Education and Training Center here is having a monthly ECHO series that's specific to LGBTQ care. So there's lots of resources for clinicians or social workers to get that training and to be more familiar with issues specific to the LGBTQ population. And then going just beyond that organizational and schoolwork, we should be aware of changing laws and policies that would be affecting our clients. So HB 257 or that bathroom or changing room bill, that's going to affect especially kids in schools where they have to make that plan. It affects adults in changing rooms. And the ACLU of Utah has a really good fact sheet on that, which can be helpful for people to understand how that's going to affect them. SB 16 passed last year, and so that prohibited youth from accessing like hormones, puberty blockers, surgery. So they're having to go out of state, and knowing how, if you're going to work with youth, that there's now that transgender treatment certification that you would have to get to be able to be part of that medical care. So it requires 40 hours of education and then continuing that with 20 hours every other year. So if you want more on that too, reach out and I can send some. And so when these laws are being discussed and when they're being proposed, making sure that we're writing or calling legislatures to advocate for our community. So it happens at a national level, but I think there's so much more power the smaller and more local you get. And because the national level is huge, and so we have a smaller impact. And so if we're writing our county council, city council, our local legislatures, or even writing op-eds in different newspapers, being able to actively work against that misinformation that ends up coming out. And then going beyond that, instead of just writing to our legislators, collaborating with community organizations that are pushing for change that legislators might not otherwise be willing to do. So like Nuanua Collective is a Pacific Islander LGBTQ focused group. Armed Queers is a specific socialist LGBTQ organization. And so if you're partnering with other organizations or lending your voice to them, it can amplify that a whole lot. And then you can also get involved in alternative forms of care. So like the mutual aid group that Salt Lake has free fridges throughout the community, has like community distribution to unhoused neighbors, has free markets for people to access goods. So seeing how you can participate in larger scale change just outside of the legislature. So different forms of like care and activism can be very helpful for LGBTQ people because proportionally they face more discrimination, and so more issues within housing, within resources, and things like that. So thank you so much. I can take a look at the chat and see if there's questions or that either myself or Ariel can answer.
There's a lot of requests for our list of gender affirming mental health providers, community resources, training opportunities. So I will send those to the coordinators of the event, and they will send that out with the slides.
Are there any other questions that are specific to things we went over?
Well, I will jump in then again and just say how grateful we are, Annie and Ariel, for the time, for the expertise, for the support and the encouragement. I think these are all such critical things for us every day, but it feels like especially during these days. I also want to say I think this is worth repeating over and over again. The social work welcomes and accepts all people who seek care and can benefit from our services. And in many ways, that's what sets us apart from those who seek to detract from our profession. We also understand that we have a commitment to the most vulnerable members of society and a responsibility to advocate for human rights and social justice. And nothing will deter us from our professional mission. So thank you to everyone who joined us today. For attendees seeking continuing education hours, please watch your email in the coming days. You'll get a link to the recorded presentation and a brief quiz. And once you complete the quiz, the CEU certificate will be emailed to you. The College of Social Work is proud to have both hosted and partnered with Campus Allies to support multiple events that celebrate our LGBTQA2S plus community. Our steadfast goal during Pride Week and every week is to remain unwavering and undaunted in our collective goal to lift each other up. And with that, I hope that you will join us for our other sponsored Pride Week events, which you can find on our website. And in closing, thank you again for being a part of this event. Be kind, be safe, be well, and look out for each other. And I hope you have a great afternoon. Thank you so much, Annie and Ariel. Much appreciated.